We're joined now by Dr. Andrew Tomita. He speaks to us via Zoom. Dr. Tomita is a senior lecturer at the School of Nursing and Public Health at the University of KwaZulu-Natal. A very good evening to you, and thank you so much for joining us, Dr. Tomita. I'm just wondering what inspired this study, and is it the first of its kind, particularly in South Africa?
So this is a wonderful question, and thank you very much for having me, and good evening to the SABC viewers. Yes, I am very glad that you brought this question up. So what we found is that individuals living in a community affected by disaster are more likely to experience depression in the long run, and it's particularly concentrated amongst what we call socially vulnerable population. So to many, it may not come to a surprise about our finding, but just allow me to put this in a research in a context. Climate change is perhaps one of the most defining sustainable development challenge in the region. And although climate change is one of the key drivers of disaster, there is not enough attention in the region, believe it or not, or even a large-scale evidence that speaks to the mental health impact of community disasters. So our investigation conducted by UKZN, a transdisciplinary group of researchers consisting of health, agriculture, life scientists, here at UKZN fills an important gap and provide first large-scale empirical evidence. Empirical meaning a study that involves actual data on the likelihood of depression among individuals living in community affected by disaster. And we hope that our research raises a further awareness about the danger of climate change on mental health, especially the vulnerable communities.
You know, it's very interesting, and this is why I was asking if this is the first study of its kind, particularly in South Africa, given South Africa's political history where we had systemized discrimination, particularly when you look at spatial areas. So one would think it's a no-brainer that the majority of the population being segmented in such small areas of humanitarian settlements would experience strife. But I'm just curious, were there any particular markers that you were looking for, anything that inspired you to look at this link between socio-economic problems, the gap between science and, as you said, understanding and solving environmental issues?
So it is exactly what you just stated, that many of the reports that I've looked at has been pointing to the gendered and poverty aspect of climate change. So, but I feel that there hasn't been enough evidence on the topic. So, as you know, and maybe it may not be so obvious to the international viewers of the show. Unfortunately, gender inequality and poverty are, stubbornly or persistently high in South Africa. And within the context of climate change disaster in South Africa, women and Black Africans are the majority socially vulnerable population. And our study shows that they were disproportionately affected by disaster. I'm a social scientist, social epidemiologist, so I focus on social structure, on poverty. And so I think people who are socially vulnerable tend to have fewer resources and support to psychologically cope with the consequences of disasters, and therefore are prone to depression caused by the disaster. But yes, I did start with wanting to answer a question about the social vulnerable population, and then also about the general impact the disaster I have on mental health in a large scale national-based evidence.
Andrew, tell me something. How does it present itself? Because if you're not educated about what depression is. It's very difficult to identify it, and then there are cultural misconceptions about depression. So just start with that, and how many people were enlightened, empowered about what it is that they're going through, for them to even see the link between that and the community disasters that they'd been suffering.
So, Sophie, so I just want to clarify a couple of things here. Is that our study is based on data about approximately 17,000 South Africans,
Okay.
Who are considered no or low risk of depression. So that is a large number so we 17,000 people to begin from, and those are large numbers. So what we did was that we observed. We have the data of those 17,000 individuals, and then we observe the likelihood of depression later on, depending on where they lived in a community that was impacted by disaster during the course of the study, which spans could be as long as almost a decade. So just going back to your question about awareness about mental health, I know, of course, there is no health without mental health, and the government should, I feel like I keep banging on this concept a little bit, but yes, a government have the responsibility to make mental health care available to individuals who need it. And unfortunately, when it comes to depression, most of the individuals who are suffering from depression, it goes untreated. So one of the things that I like, that needs to happen is availability of mental health services in a setting that people have access to, that may involve primary health care setting. But I think a lot of us have been banging on this kind of concept, bang the pot just to get this, going from plan to an actual action and make the service available to the individual who need it. But one of the important findings is an importance of religion, that amongst certain socially vulnerable populations, particularly in a low-income individual, we found that the people who believed that religion played an important in their life was protective against first onset of depression. And this is such a kind of a very important finding that it's such an important finding that we could look beyond government, that
there's a way of becoming self-sufficient.
Mm-hmm. Yes, and the faith-based organization will have such an important role to play. Imagine that there is total lack. Assume that there's total lack of mental health care available in the nation for the vulnerable population or low-income people. So the next responder is often families. But unfortunately, in the field of mental health care research, often we find that families are already overburdened with the care of their family members suffering from mental illness. So we call that caregiver burden, but in the absence of government availability of mental health care or lack of family support when it comes to mental health, I think the faith-based organization, in the context of climate change and disaster, the faith-based organization knows a community the most. Yeah. And so in the absence of any support, they might become the first responder. So this includes, like what you just stated, that they also have a major play to role in it. This could be mental health awareness and trying to and facilitate and of course, faith-based organization, they do many things, but they are, I believe that they are very instrumental in creating what we call the resilient community.
All right. So, Andrew,
in the
let
fight
me
against
ask this
climate
thing.
change.
So, our government often speaks about the importance of public-private partnerships in such matters, but I'm sure if you speak to, and your study probably bears true to this, a lot of South Africans, your study is during the period 2008 to 2017. I mentioned in our introduction the events of July last year, that there are a lot more South Africans who are feeling despondent. I mean, look at what is happening today. There's a lot of rain, there are a lot of flooded areas. You spoke about the poverty trap earlier on. There are families who are used to living like this, shacks who every now and then they have to be evacuated, they lose their property. From a policy perspective, what can government do? What broader risk reduction plan can they draw up to alleviate what people are suffering?
I think the role of the government. I think I think that there's been quite a number of research about that topic. But I think based that's relevant for our study is that it's that we need to put plans into action, including timely access to community-based support for disaster survivors, and really prioritize the care for socially vulnerable population by making mental health services more available, more accessible in the primary healthcare setting. So that's what I could that is a recommendation that I can provide based on this study.
All right. Thank you so much for your time and your insights. Dr. Andrew Tomita is from the University of KwaZulu-Natal. He is a senior lecturer at the School of Nursing and Public Health. And this study, it's titled Community Disaster Exposure and the First Onset of Depression. And it is ostensibly to understand the gap between science and practically solving these socio-economic problems and those that affect the majority of our communities.